So you might ask, okay, what is actually gluten? Well, gluten are actually storage proteins that are found in all grains. It's not just restricted to wheat and barley and rye or oats. It's found also in corn and rice and other grains as well. It makes up about 80 to 90% of all the proteins that are found in that particular grain. So that's essentially what gluten really is. Well, a number of people do have a problem with gluten, and here are a couple of the reasons why. The first one is that gluten is very difficult to be broken down by the human digestive tract. And as a result, some of these partially broken down proteins can irritate the lining of the digestive tract, and it can result in a problem called leaky gut. Leaky gut is where the barrier, okay, of the small intestine is compromised, and it will allow different proteins and other bacteria, viruses to pass through. And once that initial barrier has been penetrated, uh, what happens then is that some of the gluten molecules can actually interact with the immune system. Now, there is about 70 to 80% of the entire immune system is located in the digestive tract. Your immune system does regulate inflammation throughout the body. So when the gluten comes in contact with different immune cells that are embedded in the digestive tract, it will begin to cause an immune system reaction. And these immune system cells will actually produce compounds called cytokines, which can actually cause inflammation potentially throughout the entire body. There potentially could be a lot of health problems associated with gluten. As I previously mentioned, what can happen is that once the gluten interacts with the immune system embedded in your digestive tract, it releases different protein molecules called cytokines, which can initiate inflammatory processes throughout the entire body. Many of these symptoms, of course, can result in digestive problems. So many people will experience sometimes bloating, gas, diarrhea, heartburn, or just irritable bowel. But more importantly, it can also affect the nervous system. So it can result actually in migraines, peripheral neuropathy. They're also talking about imbalance problems. They call it gluten ataxia. It can lead to depression and anxiety, mood swings. Another area that it can potentially affect are your muscles and your joints, and it can result in migrating joint pains, just sore and stiff muscles, achy joints, growing pains, okay, just bone pain. It also has been tied into osteopenia or osteoporosis, so thinning of the bones. It can also result in hormonal problems. There's been some connections with fertility, PCOS, premenstrual syndrome. And in particular, there's a very, very strong correlation between gluten and also a thyroid problem called Hashimoto's. You could also have immune system problems, chronic respiratory or urinary infections, asthma. Could be some other things, even nail bed infections. Another one is skin issues. So eczema, mouth sores, skin rashes, just different kinds of dermatitis. Herpetoformans, okay, is another one. Also, it can result in other issues such as gallbladder issues, elevated liver enzymes, and we're finding non-alcoholic fatty liver and also autoimmune diseases as well. And it's been associated with platelet disorders. So those are some of the things that gluten potentially can be associated with. That's a great question. There are a few tests that can be done to go ahead and test for gluten sensitivity. Probably the core one is actually doing a DNA analysis. The DNA test would actually reveal certain genes that you may have that predispose your immune system to reacting to gluten. And that would probably be one of the better ways to determine whether you have a gluten sensitivity or not. There are other tests as well too, Sometimes they are, part of what they call the celiac disease panel, where we actually measure different antibodies to different compounds, in gluten. Also, some of the different, I should say, damaged areas of the intestinal tract as well can also form antibodies as a result of gluten exposure. So those are some of the basic ways of actually doing that. And we do have the capability of doing these tests at our office. So if you're interested in looking into this a little bit further, you can contact my office and speak to one of my staff members by calling 480-732-0911. And also I wanted to mention to you as well, you can look at our website, but if you want the latest information on gluten and other health topics, you can go ahead and subscribe to my newsletter list, and you'll be one of the first ones to be privy to getting this latest information. So once again, I want to just thank you for listening, and I hope this information is helpful.